welcome to the deep dive. Today we're getting into something that, well, probably resonates with a lot of you pet owners, Amitraz. We've looked into Amitraz toxicosis in animals, and while it hits various species, we'll mainly focus on dogs. They just seem to encounter it more often.
That's right. But we'll definitely touch on cats, too, because they have a particular sensitivity. It's important.
So what exactly is Amitraz?
Okay, so it's a formalin acaricide, basically a chemical designed to kill ticks, mites, lice as well.
Ah, one of those.
Yeah. And if you got a dog, you might have seen it around. It comes in different forms, like emulsifiable concentrates you mix up.
Right, the liquids.
Yeah, or those collars, the ones impregnated with it that release it slowly. Those are 9%.
Okay.
And then there are spot-on solutions. Various concentrations there. Some have been discontinued. Some are still around.
Got it. So pretty common stuff for parasite control. But like anything, there's another side to the coin.
There is.
Our mission here is to really dig into how this, helpful medication can sometimes cause toxicosis. What should you be watching for? What are the key signs?
Exactly. Knowing the signs means quicker action, which is crucial.
And you mentioned it affects several body systems.
It can hit the nervous system, the cardiovascular system, so heart and vessels, even the endocrine system, specifically the pancreas and blood sugar regulation,
Wow.
and the GI tract, too. Most of the signs we see are linked to its activity as an alpha-2 adrenoreceptor agonist.
Okay, that sounds technical.
It is a bit, but we'll break down what that actually means for a pet as we go. It explains a lot of the symptoms.
All right, let's dive into that. How does this toxicosis actually, happen? It can't be that every dog with one of these collars gets sick, right?
Oh, no, definitely not. When used properly, it's generally safe, but toxicosis usually happens in a few main ways.
Like?
Well, a really common one is ingestion. The dog chews on or swallows that impregnated collar, or maybe just pieces of it.
Okay. And because it's slow release?
Exactly. That's the key part. It's designed for sustained release, so swallowing it means a continuous dose internally. It's not just a one-off hit.
Right, that makes sense. What else?
Improper application directly on the skin. Maybe using the concentrated stuff without diluting it correctly.
Or using way too much.
Yeah, or using a product meant for a huge dog on a tiny one. Or just messing up the application somehow.
Okay.
And then the most obvious, I guess, is if they manage to swallow the actual undiluted liquid product.
Oof. Yeah, that sounds bad.
It can be very serious, but again, it's important to stress, if you follow the label directions precisely, toxicosis is much less likely.
But it can still happen sometimes.
It can. Some animals might just be individually more sensitive, and then you have those really rare, unpredictable reactions, what we call idiosyncratic reactions. Even with correct use, something just goes wrong.
Okay, so who's most at risk then? We know dogs see it more often just due to product use.
Right. Dogs are more common cases, but cats. Cats are definitely more sensitive to Amitraz.
Really? More sensitive?
Yeah, they tend to have stronger reactions even if they aren't exposed quite as often, so extra caution with cats.
Good to know. What about within dogs? Any particular types?
Older dogs seem more susceptible, and also the really small toy breeds, they seem predisposed.
Okay, old dogs and small dogs.
And really, any animal that's already elderly or sick with something else or just generally debilitated or weak, they're going to be at higher risk for more severe effects if they get exposed.
Right. Underlying conditions make everything worse. So let's say someone suspects an issue. What are the red flags? The absolute call the vet now signs.
Well, often the signs develop pretty acutely, meaning quickly, after exposure, whether that's skin contact or swallowing it.
Okay.
History-wise, you might realize, hey, the collar's missing, or you actually find chewed-up bits. Sometimes owners even see pieces in vomit or stool later on.
Right, the physical evidence.
Exactly. Then, when the vet examines the pet, we're looking for a cluster of signs. Neurologically, it can be a spectrum.
Like what?
Anything from just mild depression, sort of sleepy or lethargic.
Just not themselves.
Yeah. All the way to significant weakness or ataxia that's like a drunken, wobbly walk.
Okay, wobbly gait. And you mentioned cardiovascular effects.
Bradycardia, a slow heart rate, is very common. And hypotension, which is low blood pressure.
Slow heart, low pressure. Got it. What about the gut?
Vomiting can happen, and like we said, you might see collar pieces in the vomit.
Right.
We also see something called gastrointestinal stasis. Basically, the gut motility, the movement, slows right down or even stops.
That sounds problematic.
It can be, yeah. It compounds the issue.
Any other signs an owner might notice at home?
Their body temperature can go either way, actually. Sometimes hyperthermia, they get too hot. But
Yeah.
quite often, it's hypothermia, their temperature drops too low.
Huh, okay. Either extreme.
Yeah, and metabolically, a really common finding is hyperglycemia, high blood sugar.
High blood sugar. Why is that?
It inhibits insulin release from the pancreas. So this is especially significant if the pet is already diabetic,
Oh, absolutely.
Yeah.
That could really complicate things.
Definitely. You might also see them drinking more and peeing more polyuria, and their pupils might dilate, get really wide. That's called mydriasis.
Wide pupils. Okay.
And look, while the prognosis is generally good if they get treatment,
There's a but.
there is. In severe toxicosis, death can occur. It's serious stuff.
Okay, so quite a range of signs. Now, when a vet sees an animal like this, maybe lethargic, slow heart rate, wobbly, it might not scream Amitraz immediately.
Hmm.
What else could be going on? What are the lookalikes?
That's a really important question. The differential diagnosis, yeah. Ruling other things out is key because so many things can cause similar signs.
Like what sort of things?
Well, think about other drugs. Recreational drugs like marijuana, if a pet gets into that,
Happens all the time now.
it does. Then prescription meds, opioids, barbiturates, benzodiazepines like Valium-type drugs, even certain phenothiazine tranquilizers, some blood pressure meds, muscle relaxants, antidepressants, they can all cause that kind of central nervous system depression.
Wow, okay, so knowing if the pet could have access to any medications is vital.
Absolutely crucial history. And it's not just human meds. We also have to consider other parasiticides.
Like ivermectin.
Exactly. Ivermectins, other avermectins, milbemycins. Usually it takes a pretty high dose, or happens in those breeds known to be sensitive, like certain collies.
The MDR1 gene mutation.
Right, that one.
Yeah.
But they can cause neurological signs that look similar.
Okay, what about common household stuff?
Oh, yeah. Macadamia nuts can cause weakness and lethargy in dogs. Tea tree oil exposure if they chew on an albuterol inhaler.
Really? Inhalers?
Yep, the stimulant effect can sometimes manifest in weird ways initially or cause secondary issues. And then alcohol's ethanol, like an alcoholic drink.
Or rubbing alcohol.
Isopropyl alcohol, yeah. Methanol, sometimes found in windshield washer fluid or cleaners. And the really nasty one, ethylene glycol. Antifreeze.
Antifreeze is super dangerous.
Extremely. Causes kidney failure but can have neurological signs early on too.
Goodness, this list is huge. It really shows how careful vets have to be.
It does. And we haven't even mentioned actual medical conditions yet.
Oh, right. Diseases that mimic poisoning.
Yeah. Things like tick bite paralysis, botulism, maybe some kind of head trauma, undiagnosed or poorly controlled diabetes, Cushing's disease, hypothyroidism, low thyroid function.
All causing lethargy or weakness.
Severe anemia, heart failure, even anaphylactic shock in some presentations. They could potentially overlap.
So how do you sort it all out?
It really comes down to combining everything. The history was their access to Amitraz, finding evidence like collar pieces, and then systematically using tests to rule out those other possibilities.
Okay, let's talk about those tests.
Yeah.
If Amitraz toxicosis is high on the suspicion list, what specific tests might a vet run?
Well, blood work is almost always step one. A CBC, complete blood count.
Checks red cells, white cells.
Right. And a biochemistry profile, which looks at organ function, electrolytes, proteins, and a urinalysis. These give a good baseline picture.
And what are you looking for specifically related to Amitraz?
The most consistent finding, as we mentioned, is that hyperglycemia, the high blood sugar. That's from the insulin inhibition. What's interesting is, even though the liver metabolizes Amitraz, you don't usually see big spikes in liver enzymes on the blood work. It's uncommon.
Okay. What about imaging, like x-rays?
Yeah, abdominal radiographs or x-rays can sometimes be helpful,
How so?
especially if you suspect they swallowed part of a collar. Now, the plastic or fabric of the collar itself usually won't show up.
Not dense enough.
Exactly. But the metal buckle might. If you see a buckle sitting in the stomach or intestines on an x-ray, that's pretty suggestive.
Oh, a clue.
A big clue. There are also more specialized lab tests that can actually identify Amitraz residue on the pet's hair or in stomach contents or vomit.
Oh, okay. So you can definitively prove exposure,
Yes, finding it confirms exposure occurred. But there's a catch.
which is...
The amount detected doesn't really correlate well with how severe the symptoms are.
So it proves they got into it, but not necessarily how badly it's affecting them.
Precisely. It confirms the what, but not the how bad.
You mentioned severe cases before and potential death. If things get really bad or exposure's prolonged, does it cause lasting damage? Like, what would we see in tissues?
Yeah, studies looking at high dose or prolonged exposure have shown some changes. Things like increased liver weight,
The liver's working harder.
Potentially, yeah. And slight enlargement of the actual liver cells, the hepatocytes. Also some subtle changes in the adrenal gland.
Adrenals. Near the kidneys.
That's them. Specifically, a thinning of some layers, the zona fasciculata and reticularis, and maybe a slight increase in cell numbers, hyperplasia, in another layer, the zona glomerulosa.
Okay, so it's not just the immediate brain and heart effects. It can have these wider, more subtle impacts too.
It seems so, particularly with significant exposure levels.
All right, let's shift to treatment. A pet comes in, you suspect or confirm Amitraz toxicosis. What happens next? How do you manage these cases?
Well, it really hinges on severity. If an animal is severely affected, very depressed, unstable vital signs, they absolutely need inpatient care. Hospitalization, 24/7 monitoring.
Makes sense. What if it's really mild? Say, a dog licked a tiny bit off its skin after you applied a spot on correctly.
Yeah, in those very mild cases where maybe they're just a little bit drowsy after a proper topical application, the effects are often really transient. They might just need observation, maybe at home, maybe for a few hours at the clinic, but often no specific intervention beyond supportive watching.
Okay. But what if the signs are a bit more noticeable after skin exposure? Maybe moderate lethargy.
Right. For mild to moderate signs after topical exposure, the first step is decontamination.
Washing it off.
Yes, but carefully. You need to wear gloves to protect yourself first. Then gently wash the affected skin area with a mild dish soap. Dawn is often used and rinse really thoroughly with lukewarm water.
Get any remaining drug off the skin.
Exactly. After that, it's mainly supportive care. That might mean IV fluids to maintain hydration and blood pressure.
Keep fluids going in.
Yep. Making sure their body temperature is stable, warming them if they're cold, cooling if they're hot, nutritional support if they're not eating, and just close monitoring of heart rate, blood pressure, etc. until they perk up.
Okay, that sounds manageable. But what about the collar ingestion scenario? That seems trickier.
It definitely can be. If you know they just ate it like minutes ago and it was a big piece, an endoscope might be an option.
The camera down the throat.
Yeah, go down into the stomach and try to grab it, but honestly, it's often not practical.
Why not?
Because dogs usually chew these things up into lots of small fragments. They're not usually sitting there as one big piece in the stomach. They're scattered.
Ah, so you can't just grab one thing.
Right. The pieces might already be moving into the intestines, so endoscopy is often not the answer.
So if you can't physically pull it out, what's plan B for recent ingestion?
If the dog swallowed it recently but isn't showing symptoms yet, we might try to make them vomit.
Induce emesis.
Correct. Usually with 3% hydrogen peroxide given orally.
Yeah.
There are specific doses based on weight. But importantly, other drugs sometimes used to induce vomiting, like apomorphine, aren't ideal here. And especially not xylazine.
Why not xylazine?
Because xylazine is also an alpha-2 agonist, like Amitraz. It would just make things worse.
Oh, right. Good point. Avoid that one.
Definitely. And another thing, activated charcoal, usually a go-to for poisonings.
Yeah, binds up the toxins.
It doesn't seem to bind well to Amitraz, so giving charcoal isn't really considered effective in these cases.
Okay, good to know what not to do as well. So, peroxide, maybe, but no xylazine, no charcoal. What can you do to help get the fragments out?
If vomiting doesn't work or isn't appropriate, we focus on moving things through the other end. Feeding a high-fiber or bulky diet can help.
Like?
Simple things like whole wheat bread, maybe some canned pumpkin, psyllium husk like Metamucil, or a vet might use lactulose. The idea is to add bulk to the stool.
Push the pieces along.
Exactly. Push the fragments through the intestines faster. Sometimes a warm water enema can also help stimulate bowel movements.
Okay. Now, what about the cases where the animal is already sick, showing that significant depression, the slow heart rate, all those systemic signs we talked about?
Right. For those moderate to severe cases, we need to actively reverse the drug's effects. We use specific pharmacologic reversal agents.
The antidote.
Pretty much, yeah. They target those alpha-2 adrenergic receptors that Amitraz stimulates. The main one we use is atipamezole.
Atipamezole, brand name in its sedan. Vets use it to reverse sedation sometimes.
That's the one. It's a potent alpha-2 antagonist, so it blocks Amitraz's effects. It works quite rapidly, often reversing the sedation and bradycardia within minutes.
Wow, that fast.
Often, yes. And it can be given repeatedly if the signs start to come back.
Okay, is that the only option?
There's another one called yohimbine, brand name Yobine. It's also an alpha-2 antagonist.
How's it different?
It's usually given IV, a bit more slowly than atipamezole. It also helps reverse the depression and the slow heart rate. And it can improve that slowed gut motility too. With yohimbine, the goal might be slightly different. Sometimes we aim to get them just to a low level of depression, but with all their vital signs, heart rate, blood pressure, temperature, glucose back in the normal range.
Kind of a partial reversal.
Sometimes, yeah, finding a balance.
And if they've swallowed a collar and it's still releasing Amitraz inside them, do you have to keep giving these reversal drugs?
Yes, that's a critical point, especially with collar ingestion. You have to monitor them very closely for recurrence of signs.
Because the Amitraz keeps leaching out.
Exactly. And the reversal agents, like atipamezole and yohimbine, have relatively short half-lives in dogs. They wear off faster than the Amitraz might, especially if there's an ongoing source like collar fragments.
So the symptoms come back.
They can, so you might need to give repeated doses of the reversal agent, sometimes every few hours, until you're confident the collar pieces have passed through. Maybe you see them in the stool.
Right. Constant vigilance.
And one more thing on medications. Avoid atropine.
Atropine, often used for slow heart rates.
It is. But in Amitraz cases, it can actually make the GI stasis, that slowed gut, even worse. So it's contraindicated.
Good to know. Avoid atropine. Use atipamezole or yohimbine instead. Are there risks with those reversal drugs themselves?
Yes, if you give too much or give it too quickly sometimes, you can overshoot.
What happens then?
You might see side effects like agitation, maybe some apprehension, general CNS stimulation, and very rarely, potentially, seizures if the dose is excessive. So careful dosing and monitoring are key.
Okay. So let's say the pet has been treated, the reversal agents worked, maybe the collar pieces have passed, they're starting to feel better. What's the follow-up plan? What do you watch for?
Continued monitoring is still important during that recovery phase. We keep a close eye on those vital signs. Body temperature, blood pressure, blood glucose, heart rate.
Make sure everything stays stable.
Right. And just observing them closely for any return of those clinical signs, the lethargy, the wobbliness, etc., usually for at least 24 to 72 hours after they seem better.
But it could still recur.
It could, especially if it was a severe case or involved ingestion. As we said, you might need repeat doses of the reversal agents if symptoms pop back up before all the Amitraz is out of their system.
Okay. But the good news is...
The good news is, once the toxicosis fully resolves, we generally don't expect any long-term adverse effects. They tend to make a full recovery.
That is definitely reassuring. Okay, so to kind of wrap this all up, what are the absolute key takeaways you want people listening to remember about Amitraz?
I think the main things are, Amitraz is generally safe when used correctly. Follow those label directions to the letter.
Read the label.
Yes. But know that ingestion, like eating a collar or improper use on the skin, can lead to serious, potentially life-threatening problems.
And recognizing the signs early is key.
Absolutely critical. That lethargy, the slow heart rate, maybe vomiting, wobbliness. You see those signs, especially if there's been potential exposure, get veterinary help fast. Early treatment makes a huge difference.
And remember the specific risks.
Right. Remember, cats are more sensitive, and older dogs, toy breeds, might be more susceptible. Be extra vigilant with them.
So, bottom line, careful application, use the right product for the right animal at the right dose.
Exactly. And safe storage. Keep those collars, liquids, whatever form it's in, well away from where pets could possibly chew on them or swallow them.
Especially if you have a dog that's known for eating things it shouldn't.
Definitely. Knowing your pet's habits helps with prevention, too.
Okay. So, thinking about everything we've discussed, how Amitraz signs can overlap with so many other poisonings, even medical conditions, it leads to a final thought for you, our listener. What practical steps can you take right now to be more prepared for any potential pet health emergency, not just this one?
Yeah, that's a good point.
Maybe it's as simple as making sure you have your vet's number and the number and address for the nearest 24-hour emergency animal hospital saved in your phone and posted somewhere obvious at home.
Could even be looking into a pet first aid course, learning some basic assessment and response skills.
Exactly. Being proactive, knowing who to call and where to go immediately. That preparation could make a critical difference in any emergency situation. Something to think about.